here, and I believe he has, like Ms. Posey, I believe he has someone with him.
Good morning, Representative Jones.
Hey, good
Thank you.
morning.
Thank you for being down here.
Thank you, Mr. Chairman, very much. Members of the committee, thank you for having us this morning and hearing this incredibly important information. I'm joined up here with some of the family members and some survivors today with me. What I want to be perfectly clear about, I'm here to represent, there's a core part of our Declaration of Independence, the consent of the governed. And I think that should apply. Thank you. I believe we all in here believe in the truth and the justice of our Constitution. And so that's why I'm here, because nobody should be forced to get a vaccine, to wear a mask, to do these things without their consent, without individual consent. Now, with looking at this situation that's been going on, I want to go back a little bit here. Last year, I started hearing rumblings in my local community from local doctors of how they were treating COVID-19 and success that they were having treating COVID-19. Today I've got, and I only brought 5 packets with me, but I'm going to email this to your group. I can share it with the whole committee here. Can we pass this out, Mr. Hogan? Thank you.
And Representative Jones, just make sure you do get that email to us so that I can make sure that all 17 members of the full Medical Affairs Committee receive a copy of it.
Okay, thank you, Mr. Chairman. And what I'm going to go through in these packets here, so I've got local doctor testimony. A doctor called me just a couple days ago and said, Stuart, I want to let you know what's going on. What I think is going on, often we've talked about this in economics, about central planning, about top-down government approaches where they push things down, push dictates and laws and mandates and all this stuff down on people. But what these doctors are telling me is that they are getting this guidance, the CDC, Dr. Fauci, even DHEC to some degree, are pushing this guidance down the hospitals, not allowing these doctors to treat their patients as they see fit and to look at the clinical trials of what's actually working. Doctor called me a couple days ago, said, Stuart, I've been told I can no longer prescribe ivermectin. I've saved people's life with that drug, with that medicine. And so that's the kind of stuff that's going on. There was a doctor in Lawrence County who had incredible success treating COVID-19 with hydroxychloroquine and azithromycin. And she started getting orders from the top threatening her licensing, threatening her in various ways about prescribing this treatment to patients. I saw it firsthand. I did an interview with her, and I've included the links to all this in the packet of information. But what she told me, there were 2 twins in their 50s. One of these twins was her patient. The other twin was not her patient. Okay? Both these twins contracted COVID-19 around the same time. Her patient, she got to him within the first 10 days of showing symptoms and prescribed him this treatment. Within 48 hours, he was 85% better. 85% better. The brother, the identical twin who wasn't her patient, who the doctor told, come back if it progresses, if it gets worse, he ended up in the hospital, and luckily, months later, he was back home, but still on oxygen. That really opened my eyes to what was going on. I've also got plenty of constituents and people from around this state who have had these kind of stories where primarily their local doctors are trying to help. They go into a hospital, and the hospital, through some kind of formulary, some kind of protocol, that the hospital is not allowing these doctors to treat patients as they need to.
Representative Jones, I want to stop you right there and ask a question. Can you tell me whether or not, when you mentioned that their license was threatened, can you tell me whether or not any of this came from DHEC, any of these orders or anything came from DHEC?
Yes, sir, Mr. Chairman. Last year, and I believe it was March 25th of 2020, there was some of the board, there was an order by the Board of Medical Examiners and Pharmacists Board that came down, and it had some really troubling information. I've included it in this packet, but when that came down, when you look at it, it's basically deterring these doctors from using that azithromycin and hydroxychloroquine treatment.
But did it come from DHEC? That's what I'm trying to figure out. Did it come from DHEC?
Yes, sir. There are references to this on DHEC recently. Actually, put on their website the dangers of hydroxychloroquine and ivermectin on their site, and they reference state statute that basically holds pharmacists and doctors accountable. They do reference that in there, so it's kind of like they're deterring them from using that. But
I'm going to come back to that cabinet
Okay.
agency later, but you continue on, please.
yes, sir. Yes, sir. What I've done in this packet, I've included a number of very important things from, I was talking about a top-down approach. How this whole, I think when we look back at this moment in time, we're going to see the mismanagement of the bureaucracy and government action from the top.
All right, excuse me, stop, please.
Please
Listen,
hold,
I
please
have
hold.
to, we
Thank
have,
you, thank you.
Mr. Jones, if you can help me with this.
Yes, sir. Yes, sir.
I appreciate the passion. I share your passion, but we do have rules in the Senate that even in committee meetings, we cannot solicit any kind of input from the audience. It's just the decorum of the Senate that we have to keep, and I'm not trying to chastise anybody, but I have to just make that clear. Even if you feel it, let's just kind of keep it quiet so I don't get a rule called on me here. So thank you.
Yes, sir. Thank you, Mr. Chairman. So some of the reports that I have in here it shows kind of just what I'm seeing, a guideline of what others have seen here, where the CDC, for instance, they put hydroxychloroquine, they put it as an investigational drug on their website, okay? And this was back in March of 2020, okay? By the end of March and the beginning of April, that was removed from their website, okay? In between that time, Dr. Fauci had come out and said, don't use hydroxychloroquine, and deterred people from using that. And then also you can see in the packet where that was removed from the website. Doctors in South Carolina were pushed by DHEC and other state agencies saying don't use ivermectin, don't use hydroxychloroquine. We don't have a law in South Carolina stopping doctors from doing this, but I think this entire situation, what we're seeing is a top-down approach that is causing people to die. It's causing people not to get treatment early on, not to get therapeutic treatments like the monoclonal antibodies, for example. And I'm hearing these cases. You heard some cases earlier about Florida. Tennessee. There are patients in hospitals in Tennessee that are receiving hydroxychloroquine. Those doctors are able to do everything they can to try to save that person's life. So my question that I'm asking today, and what I want to get around to here, is asking why is the CDC, why is DHEC deterring doctors from helping patients every possible way that they can, using every tool that we possibly can use? Why is that happening? I would like to ask for an investigation to be done with the CDC and DHEC on these numbers. Some of the things that really concern me as well as we're talking about the numbers in schools right now. One of the school districts recently, and I'll just give you an example, got 2,700 students that have been quarantined, 2,700. And out of that 2,700, about 350 of them actually have COVID-19, actually have a positive case of COVID-19. Why are we quarantining healthy people? Why are these things being done? So my general message, though, early treatment, early preventive treatment, prophylactics are helping people. And so I want us to ensure as a legislature that people have a right to try in South Carolina, that they're able to go to their doctor without obstruction, without a barrier, and get these treatments as they choose, as their doctor chooses. I've got a few of these people I talked about with me here today.
I
Yes,
think,
sir.
Representative Jones, before you move on to the people you brought with you, I want to make sure there's not a question for you. Senator from Colleton has a question.
Absolutely.
Representative Jones, you're in a legislative body, so you're used to the idea that there are differing views on differing sides on almost every issue under the sun. Am I correct on that?
Yes, ma'am.
And
Yes, ma'am.
you've talked about the constitutional rights and the constitutional issues. And when I went to law school, I would learn that your rights begin where your nose ends, to the protection of others. You can't yell fire in a crowded theater because others would get hurt. There's been arguments on the abortion issue that a woman does not get to control. We passed the fetal heartbeat the last time on the same issue, and the argument on the other side was I have a constitutional right to do what I want to with my body. So the majority won on that issue, and Constitution did not matter as to a woman and her arguments. You've talked about that this is a top-down approach. Well, don't you agree that it's also a top-down approach as it relates to mask wearing, which is very cheap, to stop the spread or to limit the spread? And there's a top-down approach that there may be an argument on the other side that there should be a stronger argument, and we wouldn't have this disease continuing on if there was a mask mandate and a vaccine push from the top down, that same top down that you're talking about. And you would agree that you're not a doctor, I don't believe, and you would agree that this ivermectin you're talking about is the same thing we used to use on my 17-year-old dog to perk him up to keep him from dying. Is that what you, and that's not a trial drug. That's been around a long time on farms. You would agree that there's some varying opinions on this issue?
Absolutely, yes, I would agree with that. But ivermectin is it's a world-renowned drug that's been used in human consumption, hydroxychloroquine as well.
Have you used ivermectin on yourself?
I have not personally,
Okay.
but I know a lot of people that have and that have had success with it. And I know doctors that prescribe it.
Then let them prescribe it.
But
I'm
yeah.
not going to use it. My point is, I don't think we are in a position one way or the other to say yay or nay what a doctor should or should not do. We just want, honestly, my position here on this committee is I want to make sure that these hospitals and healthcare professionals have the tools that they should to use their medical training to determine what care their individual patient has. And I want to make sure that we get access to medical care for everybody, especially these hospitals. I want to make sure that these schools have access to testing, and I want to make sure that they have the ability to keep themselves, those teachers, bus drivers, maintenance workers, and the students healthy. And I want people to respect other people and wear their masks.
Senator McLeod.
Thank you, Mr. Chair. Representative,
Yes, ma'am.
I've listened to your testimony, and a few questions actually come to mind. So you are here to ask that we investigate the CDC and DHEC for, I don't want to put words in your mouth, but can you reiterate briefly what you want us to investigate?
For the guidance that they're pushing down on our doctors, on patients, and people in South Carolina in general.
Okay. So you disagree with the guidance, even though you've admitted that you're not a doctor, not a public health expert, correct?
Well, I want to know why they've put guidance up and then removed it and then gone to such an extent to deter doctors from using these treatments when doctors are telling me they're having success with them.
Okay, so I don't want to really go into what my colleague, the senator from Colleton, has already expressed about your comments related to the top-down approach. But certainly, I have to ask, are you So you're here, and so far, the testimony that we've heard, not just from you, but the testimony that we just heard before you, it seems that it's focused on doctors and the healthcare professionals that are, at this point, overwhelmed and not given the resources that they need or the cooperation from too many South Carolinians that they need to be able to do their jobs. And are you aware that our hospitals and our ICUs are practically full across South Carolina? I know that we're here to talk about monoclonal antibody treatments, but I have a hard time listening to complaints. That's what it sounds like. If that's not your intent, you'll have to advise me on that. But it seems as if you're complaining about the state of our state as it relates to the treatment that those who have been exposed to COVID-19 are receiving, and the doctors not prescribing the medicines or the treatments that you believe would help people recover. Mind you, the CDC guidelines and DHEC's guidelines, if I understand correctly, have never wavered in terms of their recommendations for vaccinations and for masks. But we want to, just kind of move beyond that, just kind of gloss over that fact and go completely to treatment and say, how dare you not provide the monoclonal antibody treatments to those who need it? How dare you not provide the hydrochloroquine, ivermectin, whatever the treatments are that you are asking for. So help me understand the logic in that.
Absolutely, yeah. No, the focus, I believe, it has to be on freedom. And when I hear doctors in my community saying that they are being deterred from doing what they need to do to help that patient, to keep those hospitals from getting full, there's a problem there. Why is that? That's the question I'm asking.
Okay, so if it's about freedom, why did you vote to tie the school district's hands with regard to the proviso and require that they not that they lose funding if they require masks? Did you vote for that? Were you in favor of that?
I voted to ensure the freedom of parents and of people of this state. That's my position. That's why I'm elected.
Yeah, and I want to interrupt here. I think on that particular deal, the budget passed overwhelmingly, so the majority of the people voted for that at the end of the day. So I just wanted to
True.
put that out there. I think there was only 4 or 5 votes in the Senate against it.
Gotcha. Okay.
Yeah, that was a conference committee. Right.
You're talking about the K through 12, yes. Okay.
Yeah.
I'm sorry about that.
The
I'm sorry about
yeah,
that. That
yeah,
was
no.
conference. That was conference. You're right.
Yeah, I was just trying to
I
understand.
had college in my head for some reason. Sorry about that.
Yeah, I mean, all this talk about freedom, but we are in a public health crisis. And you're right about the fact that our leadership should start at the top, especially when it comes to protecting the people of this state. So I'm tired. To be honest, I'm tired. There's so much misinformation that's been spread. There's so much that we could and should have done, and I won't belabor those points because they're obvious, and that's why we're here. But at the same time, we can't talk about what a lousy job these healthcare professionals are doing when they are.
That's not what I'm saying.
Okay. Well, that's what it.
No,
That's what it.
yeah, I'm sorry if that's the way it came
Okay.
off. What I'm saying is I want to ensure that those healthcare professionals and those doctors, nurses can provide the care that they need to provide to their patient without obstruction. That's what I'm saying.
Okay. And you feel that the CDC and DHEC are
Yes.
obstructing?
They have redefined terms over the past year. You know, if you look at the CDC, and there's more. This is just a sampling of some of the information. I'll share the folder that I've got with a lot of testimonies in it. But what this says, you know, they redefined what a vaccine is. The World Health Organization redefined herd immunity. I mean, they are challenging, and the doctors at the local level are saying, why is this happening? Why is this top-down guidance pushing us to do something that is killing people, that's not working?
Okay, so is it the lack of treatment that's killing people, or is it the lack of South Carolinians to, I mean, is it, I don't think it's a treatment issue. I think, I mean,
Well, hey, ma'am,
I don't think it's a treatment issue. I think it is, I mean, we've gotten for almost 2 years now, we've gotten information from the CDC and from DHEC, and those are the public health experts about this virus. Have things changed and evolved? Absolutely. We are here, though, dealing with the Delta variant now because we were misinformed, not by the CDC necessarily, not by DHEC, but by our state's leaders. So you're right about that. This is a top-down. These are the effects of our top-down approach. But the lack of leadership is just, I mean, when are we going to talk about that and speak to that? I don't think that investigating the CDC or investigating DHEC is the answer. We bear with personal freedom comes personal responsibility. Do you agree?
Absolutely.
Okay. So what is our responsibility in all of this?
Our responsibility, I believe, is to help unobstruct, to remove any barriers that this top-down guidance, because without a doubt, what I'm showing here is that the CDC puts out guidance and then DHEC puts that same guidance forth in our state. I'm saying let's listen to those local doctors. Let's see
Okay.
what's working for them.
Who is, I guess when you talk about obstructionists, like who's obstructing our ability to wear masks? Who's obstructing our ability to get vaccinations? I mean, those are on the front end. We're talking about the back end. Once I get COVID, then you better treat me right and you better give me the drugs or the treatment that I say I want, or you're not doing your job. And I have a real problem and concern about that because we are requiring nothing on the front end. In fact, we're tying people's hands and not allowing them to provide the information and the treatment and the freedoms that our school districts and our businesses need to keep people safe.
all right, thank you. Next up, Senator Davis has a question.
Sure, Representative Jones. Listening to this and listening to the difficulties that people are having accessing therapeutics, it seems to me that maybe what the issue here is that hospitals and doctors are reluctant to prescribe the therapeutics because they're afraid they may be violating a standard of care because of what the CDC has said or DHEC has said, that may somehow establish what I think it's what a reasonably competent and skilled healthcare professional would do under the circumstances. So in looking at this, if that's the case, if you've got physicians that are saying to their patients, I'm afraid to prescribe this to you because this guidance is out there and I may be committing malpractice, if we're looking for a solution, and that's what I'm kind of exploring here, are we looking at maybe some sort of a carve-out? Are we looking at a patient being able to assume the risk? Or are we looking for some sort of safe harbor? I mean, I'm just trying to, I hear what you're saying, and I can see if I'm a physician out there and there's guidance by CDC and DHEC saying certain things, and I take action in violation of those certain things, if something happens to that patient, there may be a tort cause of action. So is that what we're talking about here in terms of looking for what the appropriate legislative response might be?
Yes, absolutely. Yeah. maybe a waiver of liability or something to that effect that would give those doctors, because just yesterday when I got a call from another doctor saying, Stuart, I've got this patient and had to prescribe them ivermectin. My hospital system told me not to prescribe that any longer, that I couldn't prescribe that any longer. And so I think we need to ensure, and a lot of these people too have been so close to death, and some of them have died. Some of them that are here today, their family members are in the hospital right now. And they want, without having to go get a court order, they want to be able to allow that doctor to treat them, just to give them the right to try.
And I guess that's the point I'm trying to make, is for us to at least understand the nature of the inquiry here. It's not so much that the CDC and DHEC are prohibiting or enjoining actions. It's articulating standards that if the physicians don't follow, they open themselves up to a potential malpractice claim. I think that's what the deterrent here is.